I've had patients that send me photos year after year after year from joyous family events that never would have existed because these patients were told from the outset that this was never going to happen. And we made it happen.
At Sher, you get a very personalized experience.
The patient experience is obviously top priority for all the doctors here. From the moment they walk in, the receptionists know who they are, know them by their first name, and just try to make it a comfortable, relaxing environment and experience for the patients.
I think what makes Sher Fertility Institute unique in New York City is that we are willing to try new things. We are willing to do things that are novel and a little out of the box, and we see women have babies and be successful when we do this.
I think what distinguishes Sher Fertility Institute from the majority of most clinics that are out there is the fact that we place a very, very equal emphasis on both the compassionate side of patient care and the scientific, technological side of patient care.
We work well together, we enjoy working together, and I think it just adds to, the great environment here.
We understand that there can be financial difficulties associated with undergoing advanced reproductive technology, and we really want to do everything we can to make sure that women who need this treatment get this treatment. So we have an administrative financial team that will sit down with any couple and go over all the options, and we actually have quite a few.
In terms of the different teams and components, the reception team obviously greets the patients, make sure all their needs are taken care of, medical records, to the medical assistants who help us get through the day and greet them, and on the clinical side, to the physician, nurses, embryologist, and so we all have to work together as a team to really make sure that the patient has a smooth experience. Some of us are obviously on the front line, and some of us are working diligently in the laboratory, the embryologist, to really take care of the key parts of this journey.
I think probably there are a lot of couples out there that are dealing with infertility, but they're afraid. They don't want to really wrap their heads around it because sometimes there's a stigma in their minds about it. Sometimes there's the financial worry about it. What I would tell people who are dealing with this problem and are sort of sitting in the shadows about it is that they shouldn't be worried about coming in, sitting down, and talking to a reproductive endocrinologist like myself. We're here to help you, and here at Sher Fertility Institute, we try very, very hard to do so in a way where you feel very comfortable and very at ease.
Doing ultrasounds, seeing the fetal heartbeat after such a long, grueling journey, it's one of the most gratifying experiences, and to see the babies, to see the Christmas cards, and watching these couples build their family. I think every day when we have that opportunity, I think it's a very rewarding and gratifying experience.
What I hope that patients are feeling when they leave our center is a sense that they worked with a group of people that genuinely cared about them and about their goals. I never promise patients that you're going to leave here with a baby. I wish that I could. But what I do promise patients is that when you are here, you're going to be treated with dignity, you're going to be treated with compassion, you're going to be treated by a group of people that actually understand what it's like to go through what you're going through. From the woman that picks up the phone and says, "Welcome to the Sher Fertility Institute," to the embryologist who chats with the patient as we do our embryo transfers, everybody has that mindset. Everybody has that feeling. We're all on the same team trying to make that happen.